Hello, Peter Goertz. I'm a psychiatrist. So you're feeling desperate, you're depressed, anxious, or hearing voices in despair, and you want help, and then begins the journey of navigating the medical or the psychiatric system, and that in itself can be very stressful. What made me talk about this today is last week in an emergency room, I saw a patient with a serious psychiatric issue, but also with serious medical issues and on many medications. And the patient had been in the emergency room being treated there for about 5 days because no psychiatric hospital would accept her, in part, I believe, because of the medical issues. So that's one kind of patient that can have a lot of difficulty being accepted on a psychiatric ward. Other patients that have difficulty being accepted or getting a bed are autistic patients. I think because they can have difficulty participating in groups, for instance, on the ward. Patients with intellectual disability can have a lot of difficulty getting a bed on a psychiatric ward. Maybe also similarly because they have difficulty participating, for example, difficulty with activities of daily living, feeding themselves even maybe. Violent patients often are not accepted by psychiatric hospitals because of that issue. Hospitals do not want violence on their wards. And that brings up another issue. Patients can have difficulty getting a bed on a hospital ward, but once they get there, then other difficulties can begin. For example, being on a hospital ward may expose them to these violent patients that I mentioned, to psychotic patients, patients who are very disorganized, patients who can be scary for people to interact with. So there can be different levels of difficulty at different levels of our medical or psychiatric system. Another major difficulty often is insurance coverage. Medicaid, for example, tends not to pay much for psychiatric visits, so Medicaid is often not accepted by psychiatric providers, and insurance coverage of medication can be a big issue, and insurances often, if a medication is expensive, require what they call prior authorization, and that can be a process that can be quite tedious. So patients often have to wait to get their medicines, if they even get them ultimately. They may or may not even get their medicines that are prescribed by the psychiatrist. And that can lead to other issues, of course. So if a patient goes without medication for an extended period of time, they may do very poorly and need to be in a psychiatric hospital, which of course is much more expensive in general than any medication. So the system, by trying to save money, can even spend much more money than what they could have saved by not approving a medication, for example. Another difficulty patients face, and if you're desperate to get help, that can be a real problem, is getting an appointment even with a psychiatrist. Getting an appointment with a psychiatrist can take months, about 3 months in our clinic, ballpark. Same thing with getting an appointment to see a psychotherapist. And certain patients can have other difficulties. For example, some psychiatric providers do not want to see or are concerned, have reservations about seeing patients with a diagnosis of borderline personality disorder. They can have a lot of difficulty interacting with those patients, and that can be stressful for them, so they prefer not to see them sometimes. And other patients that can have difficulty getting appointments are older patients who tend to be on more medications, tend to have more psychiatric problems, more medical, physical problems in addition to their psychiatric problems. And that can be more of a challenge for a psychiatrist or a psychiatric provider to manage. So they tend to have more difficulty than some other patients getting appointments to see a psychiatric provider. So what I'm talking about overall is if you're in despair, in distress, having serious psychiatric problems, That's already a very difficult situation. But then on top of that, dealing with our medical system, navigating the medical or psychiatric system can bring serious other challenges on top of your initial psychiatric problem. And that is an unfortunate situation in our medical system. Thank you.